Hi, welcome back to the channel. Here to give you guys an update on my health situation, and also I'm doing these videos as well to try and help anybody who's going through the same as me, or in the future gets diagnosed with breast cancer, so they know what they might expect during the course of treatment. So that's another reason I'm doing these videos. So just in case there's any of you, this is the first video you've seen, I'll just give you a quick history. Earlier this year I was diagnosed with breast cancer at the hospital here in Shenzhen, China, and I was recommended first of all to have chemotherapy with the aim of trying to shrink the tumour. The tumour was quite big. It was a tumour of a size of 6.5 centimetres. So I had chemotherapy. It was originally going to be for 12 weeks. I did stop that chemotherapy after 8 weeks when it became clear that the tumour hadn't shrunk. It had stabilised. It hadn't got any bigger, but it hadn't shrank either. And the reason that's possibly, the reason it didn't shrink will become possibly clearer later in the video when I explain about the biopsy from the surgery. So I chatted with my doctors and they suggested that we go to surgery to remove the tumour, and we go from there. So this video is about my experience going into hospital and having the surgery. So it's 3 weeks since I had the surgery. I was in hospital for a period of 2 weeks, and I've been at home for a week now. I still have to go to the hospital every 2 or 3 days so they can check on the wound and change the dressings. But I really want to talk about my experience of the surgery. And the reason I want to do this is that there might be other expats or Chinese nationals, Chinese people who are going into hospital for surgery and like me were very, very nervous. And I was more nervous, I think, because I was going into a hospital in a foreign country. I've had surgery in a UK hospital before, as an adult, only very minor surgery, and this was a bigger surgery than I've ever had before. I had some quite major surgery when I was a child, but it's quite hard to remember that because it was more than 40 years ago. However, I was very, very nervous when I went in because I didn't really know what to expect. So I got checked into the hospital 2 or 3 days before my actual surgery. Actually, I went in on the Monday and the surgery was done on the Wednesday. And during those 2 days, I had a number of tests. They did some blood tests. I had a couple of ultrasound scans, both on my breast, and they also do one on your heart to check that your heart function. I filled out some questionnaires. And I also on that day had an appointment with the anaesthetist, and they asked me a number of questions, if I'm allergic to anything and things like that. I told them that I have asthma, because obviously that's important from an anaesthetist point of view. And then after all those tests, I was then seen by the surgeon who was going to remove the tumour. Really great guy, quite a young man. And he explained everything that they were going to do. And also I was visited by the plastic surgeon because the area that they're removing is quite a large area. It was a diameter of about 6.5 to 7 centimetres. As I said earlier, the tumour was 6.5 centimetres. So they cut a flap of skin and move that skin up and stretch some other skin from underneath the area to cover the wound, because unknowns to me, I actually first thought they would open the skin, remove the tumour and then just stitch it back up. But when they remove a breast tumour, they also remove all the skin and skin tissue, just in case the cells are in that tissue. So they do actually remove quite a large amount of skin. And this is one of the differences between men and women when they have breast cancer. Normally with women, this skin grafting isn't necessary because they have a lot of excess skin in the breast area, whereas men don't. You can probably appreciate breast cancer is very, very rare in men. So this was an additional complication that they had to do a skin graft. And then on the morning, the evening before the surgery, the nurses came round and they explained that I mustn't eat or drink anything. So the last time I was allowed to eat was at midnight, and the last time I was allowed to drink was at 6 a.m. in the morning. So I adhered to those conditions. And then around 10:30, they bought me a gown, a theatre gown, and I got changed into that. And then I walked with the nurse to the block where the operating theatres were. And she obviously could tell I was a bit nervous, because once or twice she said to me, "Oh, don't be nervous, everything will be okay." And she was very reassuring. That was really nice. And I arrived at the place where the operating theatres were, and then they took me in and they put me on a bed, one of those beds with wheels on, and then they covered me in a nice warm duvet. And then I could tell from the area, it was quite a large open area, and I could see various doors where the operating theatres were. And I lay there for about, I don't know, maybe 10 minutes, if that, maybe a little less. And another nurse came to me, a theatre nurse, and just asked me a few questions, took my temperature. And then they took me close to the operating theatre that I was going to go into, and at that time the door of the operating theatre was open. I was actually quite surprised how modern and high tech that operating theatre was. It almost looked like there's lots of computers in there, looked like a launch centre for some kind of space thing. It was very, very modern. And at that time I saw them just doing the last preparations to the theatre. And shortly after that, they wheeled the bed in and they transferred me to the operating table. There was probably about 7 or 8 people in there, all got their own separate jobs, and they're all doing their things. Now, because I was having some surgery under this arm, and I have my PICC in this arm, they put the blood pressure monitor around my leg, and then they linked me up to various other monitors on my fingers and things like that. And then that took about I don't know, 10 to 15 minutes maybe, while they finished off all their preparations. And then the surgeon arrived and we had a few words. He just confirmed what they were going to do, and then the nurse says she's going to put me to sleep now. So she put an injection in my hand, and I started counting, and for some reason I started counting in Chinese. So it's I, A, San, Se, U, Liu, Qi, Ba. And I think I got to about 13 or 14 and I can't remember anything else. And then the next thing I knew was that I was lying on a bed, on a trolley, and the nurse was saying, "Okay, it's all finished, you can wake up now, how do you feel?" I says, "I feel all right." And she says, "Do you have any pain?" And I said, "No, I don't have any pain." Obviously they'd injected some local anaesthetic into the area of the surgery before I was woken up. But also I had a sort of lining to my hand, and I had this device with a button that dispensed painkiller into my system if I needed it. But I felt I didn't need that. I think I might have pressed it once, but not necessarily because I had pain, just to see what happened, because I was not sure how it worked. And then shortly after that, they took me back up to the ward and they asked me if I was okay, and I says, "Oh, I'm feeling a little bit cold." So they put an extra duvet and a blanket on my bed, and I was quite sleepy, you know, so I think I nodded back off to sleep, and then I woke up again. I still felt a little bit cold, and then I asked somebody the time, and I was surprised. I've been in theatre around 7 hours, which was a big surprise to me, because it literally felt like 2 minutes I'd been asleep. So yeah, and by that time I'd warmed up. I was quite hot, so I asked them to remove the duvet. And then I found that I had a couple of drains. I had a drain in my chest and I had a drain under my arm, and every sort of a few hours the nurses on the ward would come and check my temperature, and they would check my blood pressure, and 3 times a day I would have a painkiller. It was pretty tricky for me because the whole of this side was where the surgery had taken place, and I'm used to sleeping on my front. Well, I couldn't sleep on my front, so it was a bit of a challenge for me to sleep on my back every day. But I got used to that, and for the first few days I felt really tired, and I just drifted in and out of sleep throughout the day. But then I got a bit more of a pattern sort of going. So that was pretty much my surgery experience. As I said, it was the University Hospital of Hong Kong in Shenzhen, China. Just to clarify, it's not actually in Hong Kong. A few commenters on previous videos thought it was actually Hong Kong that was it, but it's not Hong Kong. It's the University Hospital of Hong Kong in Shenzhen. And I must say, the treatment I had in there was absolutely amazing. I couldn't have asked for better treatment. It was really, really good. The nurses were very attentive. Pretty much every day the surgeon who did the operation came and checked the wound. The dressing was changed every day or every 2 days, and they kept a really close eye on me. I was discharged 2 Wednesdays after the surgery, and as I say, I go back there every 2 to 3 days just to check. It's now 3 weeks after the surgery, and all the stitches have been removed. They removed a few stitches shortly, a little bit longer after 2 weeks. Then a couple of days after that, they removed some more stitches. And finally, a couple of days ago, they removed the remainder of the stitches. Right now, on my breast area, I don't feel so much pain, but where they did the incision under my arm, which they removed the lymph glands, it's kind of a little bit sore. When the tumour was removed, actually just before that, in surgery, they removed a sentinel node, lymph node, and they did a biopsy on that, and that biopsy showed that there was some cancer cell present in that lymph node. So they proceeded to remove the lymph nodes from under my arm, and that's pretty much standard practice with breast cancer, because if the cancer spreads into the lymph node, it can then spread to other parts of the body. So they generally remove the lymph nodes as a precautionary measure. And there are various things I can and can't do with that arm in the future now. May go into that in another video. And they also did biopsy on the tumour that they removed. Now, very interestingly, they think this is possibly the reason why the initial chemotherapy didn't shrink the tumour, is that there was actually 2 sort of strains of breast cancer within the tumour. And again, that's quite rare. So that was something they discovered. Now, ongoing, I've had another consultation with the oncologist, and what they are suggesting is another course of chemotherapy. It's a lower level chemotherapy, and that's really to just make sure that any rogue cells are dealt with. It's very difficult for them to actually confirm the existence of any cancer cells, and the way the doctor described it to me, it's like a small fish in the ocean. You know, it's really difficult or almost impossible to detect. So the chemotherapy is kind of a precaution to make sure any remaining cells are sort of eliminated. And now they know that there was 2 types of cancer strain there, they can actually sort of formulate that chemotherapy to make sure it attacks any of those cells. And that's going to be for, I need to have 1 dose a week for a period of 12 weeks. Additionally to that, they are suggesting, because the tumour was larger than 5 centimetres, it is standard practice from their clinical expertise to have radiotherapy in the breast area and maybe under my arm area. So that is something I will have after the chemotherapy, and that will be for a period of 3 to 5 weeks. And from what I understand and what I've been told, there are very little side effects to that radiotherapy. It just might feel like you have some sunburn in the area where that radiotherapy is enacted. And then finally, they suggest I have some hormone therapy for a period of up to 10 years. Now that was a little bit of a surprise to me, and I would like to sort of research a little bit more about that. But interestingly, I have a good friend whose wife also had breast cancer, and the treatment that I'm being advised is almost identical to what she had. She's some years after her surgery now, maybe 3 years after the surgery, but she's also taking this hormone therapy, which was recommended for her. I think she was recommended that for 5 years. And the hormone therapy is either an injection monthly, quarterly, or taking tablets. So I haven't really decided which one I want to go for yet. Anyway, as I say, I'm very grateful to the nurses and the surgeons and doctors in the hospital who took care of me. I couldn't have asked for better care. As I say, I was very nervous going into a hospital in a foreign country. For any expats out there like myself who don't speak a huge amount of Chinese, I found the staff in the University Hospital of Hong Kong, many of them spoke English very well, and some of the nurses who didn't speak English well still managed to communicate with me with a limited amount of English and my limited Chinese, and we always understood each other. So that was really reassuring for me as well. Anyway, I hope that brings you all up to date. I'm kind of still a bit frustrated that I can't get out there and make more videos. It's a little bit boring staying at home. I'm hoping I'm not too affected by the chemotherapy that I've got to go through for the next 3 months. The treatment's lasting a little bit longer than I originally expected. I didn't expect to have chemotherapy for another 3 months after the surgery, but hey, the doctors that I'm putting my trust into know a lot more about this than I do, so I think it's good to follow their advice. And I just want to say a massive thank you to all you guys for your support or your words of encouragement. It's really helped me. I'm really keeping a positive mind. I am a positive kind of person, so I have no problem keeping a positive mind. I do have a few days where I feel a bit down, but that's more because I'm stuck at home. As I say, you can see behind me, I've been building a lot of Lego. Maybe I'll do some videos about my Lego at some time in the future. But anyway, thanks everyone. Really appreciate your support and all your kind words. But as always, for now, take care.